tonight to launch what Ash has called the 1 hour movement. Now, you probably wonder what the 1 hour movement is, but it is a job that it is an initiative where Ash and TeleMedicine Australia are going to ask all Australian registered GPs, specialists, allied health professionals to join TeleMedicine Australia by giving 1 hour of their time, either a day, a week, a month, or even a year, through various means, and whether that's social media, meetings, flyers, conference time, whatever. Just one hour a year to help with TeleMedicine Australia and telemedicine in most in need communities in Australia. And we all know there are a lot of rural areas which are most in need. We all know that there are a lot of rural areas in Australia which actually don't have a GP. They should have a GP, they're big enough to, but the communities just don't have access to a ready-made GP firsthand, and telemedicine can provide those valuable links and as a bridge as such to remote Australia, to specialists in even in a centre as large as Wongat, Temora, or indeed a metropolitan area. Now, the community, as I say, would not have any primary care service or a permanent GP in the first instance. Now, TMA facilitate the technology to connect the volunteer doctors to those towns. There's zero cost for the doctor, so they'll be pleased with that. No technical support needed, no installation needed. All doctors would receive in return a free telemedicine training. And the 1 hour movement, the aim of it is to encourage general practitioners and specialists with the capacity to give an hour of their time to assist those rural communities without a regular GP by providing telemedicine consultations from a far end practice location. Now, the objective is to establish a roster-based medical service staffed by qualified GPs to rural and remote towns and communities throughout Australia, as I say, without the services of a regular general practitioner. TMA will work in cooperation with relevant stakeholders to establish a working group, and Ash has got in mind a certain number of people who we would like to be on that working group. So if you get asked, please give it your utmost consideration. And I know that he's actually spoken to Murrumbidgee local health's Tony Hobbs, who's very keen on the idea, in the surrounding district, who are most in need, to identify those towns and places which are most in need of medical services. The working group will develop an action plan and implement a roster-based medical service provision from GPs and specialists who have capacity. That's a great initiative, and it's another thing that Ash has come up with on his own initiative to help support telemedicine in Australia, to help support indeed telemedicine Australia, so that those towns and remote locations, and often they're in areas where there's a large Indigenous population, but today, and often we've got, and in places in the Riverina and wider Central West, we've got a lot of those towns and centres. And so I think that's a wonderful initiative. I would like you to put your hands together to Ash for that 1 hour movement for Rural Australia initiative. Now, telemedicine is a great initiative, and I'll just wrap up on this. I know, and Steve Normandin mentioned it earlier about the fact that Australia's health provision was in reasonable shape compared to the country he comes from, and indeed it is. And I know that governments of all persuasions and political parties of all persuasion know how important good health care is, because look, if you've got your health, we all know you've just about got everything. And I'm on a Regional Australia Standing Committee at the moment, which is investigating fly-in, fly-out work practices, not just of miners, but also of health professionals. And we visited places in Queensland at Moranbah and other far-flung places in Western Australia, Kambalda and Karratha and other centres, where they actually fly in, fly out their Burger King and McDonald's workers. That's how desperate they are to get staff. The people who flip the burgers are being flown in some cases from Perth and from Brisbane and other centres. In other cases, the workers are being flown in from the Philippines. They're Australian taxpayers, but they earn so much in these mining communities that they actually choose to live in the Philippines and other exotic locations. But certainly those mining communities are really hamstrung by their lack of medical practitioners. And something such as Telemedicine Australia would be a godsend to those communities. It would also be a godsend to many of the Aboriginal communities in remote Australia. It would also be a godsend for those centres in the Riverina and indeed other areas in New South Wales, which actually at the moment don't have a GP, which certainly don't have ready access to a specialist, and the 1 hour movement can only help those communities. So I encourage that working group, when it's formed, to help that as much along its way as they can. I encourage all of you to spread the word. Tonight is a great night. We're very privileged to be able to be here tonight to hear firsthand from Ash and to the other experts about how good it is. We all know how good it is. What we need to do as community leaders is to go out and spread the word about how good it is, and not just in Temora, but certainly in our everyday lives, and certainly in all the people who we come across through the TAFE, through UNSW, through Riverina Regional Development, and wherever else we can, to encourage the TeleMedicine Australia and to Dr. Ash Collins as much as we can, and to ensure that this initiative succeeds, not just for Temora, not just for Dr. Ash Collins and his family, but indeed for regional Australia, because it's a great initiative. I wish it all the very best, and I'll be certainly, I know, along with my parliamentary colleague Senator Fiona Nash, will be doing everything in our power to ensure that it works. Thank and succeeds. Thank you.
Very good. Thanks, Michael. Exciting announcement there, guys, and I know that Ash and the team are very keen to hear any feedback on that specific announcement there tonight, and particularly anyone interested in sort of being involved or providing that level of feedback and consultation there. They're really keen to make that work through into fruition.